Beginning with the fusion of just 2 cells, the adult human body comprises over 10 trillion cells, an incredible number, which is achieved by repeated cell division. Over 400 different types of cells have been identified, each of which has specific functions and must communicate and collaborate extensively with others. To this end, our cells produce more than 40,000 different proteins every day. This immensely complex system works 24 hours a day, 7 days a week, to make us who we are, individual human beings, gifted with skills, capacities, and talents. But when the cellular system breaks down, illness is the result.
Hi, I'm Stefania. I'm suffering from diabetes for many years. That means that my cells do not produce insulin properly, and I have to inject myself every day with insulin.
For Stefania's complaint, a good solution would be to replace her destroyed insulin-producing cells with healthy donor cells. Once a donor has been identified and the precious healthy cells harvested and injected, however, her doctors need to track and assess the new cell's performance.
Hi, I'm Hannah. I had a heart attack last year. As I had no complaints before, it came as a complete surprise.
It appeared that Hannah's cardiac muscle was severely damaged, which impaired her condition dramatically. In a new program which she is undergoing, stem cells are collected and re-injected into her heart to regenerate into cardiac muscle cells. Crucial to success, however, is that enough cells are engrafted.
I'm John. Recently I've been diagnosed to have metastatic cancer. It was quite a shock to me.
John's immune system can fight the multiple cancer lesions, but it needs to be redirected to recognize and attack the cancer cells. Cellular anti-cancer vaccines are certainly capable of reactivating the immune system against cancer, but since it takes a while before cancer lesions start shrinking, doctors would benefit greatly if they were able to see John's immune system in action as it responds to the treatment. One major reason that cell therapy has not been able to cure all these conditions in the past is that there has been no good way to study these cells once they are inside the patient's body. Imaging can be the key in most cases. It can non-invasively answer questions like, are these cells still alive? Are they working properly? How many survive after a few days, weeks, or even years? Leading the way in this endeavor is EnSight, a creative and scientific European network in which frontline institutes performing state-of-the-art research join forces to revolutionize healthcare by developing imaging tools for innovative cellular therapies. EnSight shares ideas, knowledge, and inspiration. Prominent researchers develop techniques that allow a better understanding of how cell therapy works, starting from the very basic concept of the cell itself. For a cell to reach its destination in the human body after transplantation, it needs to travel through numerous vessels, walls, and tissues. Cell migration is a complex process that depends on many different molecules being present on the surface of cells. These molecules sense the direction in which they need to go and interact with the cell skeleton to push the cell onward. Cells that know where to go are highly mobile and change direction when required to. Not only do they sense direction, but they also use these molecules to interact with other cells in recognizing whether they are good or bad. In the case of cancer, immune cells crawl over tumor cells and kill them. As cells can be labeled, so they can be studied and tracked in living animals. For example, in mice, labeled stem cells are injected and monitored as they migrate to the animal's damaged brain tissue. Not only can we show where the transplanted cells have gone, but the tools developed within EnSight can also demonstrate that the cells have differentiated into neurological cells and have spread out to other cells to restore neurological networks. These achievements in the study of mice over recent decades have been tremendous. However, EnSight's efforts explicitly focus on translating this knowledge into routine clinical practice, making innovative techniques available to everyone. Modern imaging technology that is readily available, such as MRI, PET, and scintigraphy, allows us to study cells even after transfer to patients. This obviates the need for invasive procedures such as biopsies. Instead, the patient is simply examined in a dedicated scanner with the resultant images used to provide crucial information about the status of the relevant cells. The results from mice studies have been translated to humans. For example, in diabetic patients, studies have shown that transplanted pancreatic islet cells which produce insulin accumulate in the liver. As you can see from the graphics, the white spots are the insulin-producing cells entering from the blood vessels in yellow and are dispersed throughout the liver, which is in red. The cellular anti-cancer vaccine is injected directly into the lymph node, where a large collection of other immune cells is gathered. After injection, the vaccinated cells should activate these immune cells and train them to recognize and fight cancer cells. Using PET scanners, EnSight has developed protocols to monitor the activation of immune cells in lymph nodes after vaccination. It has become clear that our own cells can be transplanted within ourselves and to other people, perfectly adapting to the complex system that is the human body. The first results have been promising. Cell therapy has repaired damaged neurological systems. Cell therapy has initiated insulin production in patients suffering from diabetes, and cell therapy has redirected the immune system to fight cancer, an incredible breakthrough for patients.
Thanks to the new technologies, the doctor could image the transplanted cells and they show they are still alive and they can start to produce insulin again. So now I'm less dependent on my medication.
I'm happy that thanks to the stem cell transplantation, my physical condition is back to normal, so I can keep up, finally again, with my 10-year-old daughter.
My doctor can now monitor the activity of my immune system. I can't wait to hear the results.
Despite these successes, the process of using transplanted cells as therapy is extremely complex, and much about it remains to be learned. One thing we do know, however, is this: as long as we join forces with EnSight, the future looks bright.